Okay, is it clear?
Yep, it's on.
It's on?
Yep.
Okay. Assalamualaikum and good afternoon, everyone. So I'm Tuti and I'll be presenting with Dr. Aida from radiology. Before we start, maybe if you have two devices, it would be good that you watch the the webinar on Zoom using your laptop, and maybe use your phone for the audience response system. So that's the QR code, which during Dr. Aida's session, we will show that QR code again. But if you want to scan the QR code using your handphone, that would be good. Okay, I'll probably give about 3 seconds, but we'll show that again. Okay. Okay. Can I move this? Yeah, okay. So, sorry. So thank you for inviting us for this topic, creating an interactive lecture online. It is interactive lecture in itself is daunting, can be daunting, and even and what more if it's online, it can be more daunting. But maybe we can go through this together. I think, and for myself, I think preparing for this session has been a learning experience for me. So we'll divide the topic into 3 parts. Okay, so one is just a reminder about active learning, a bit of revision. Second is asking effective questions. And the third part is asking effective questions online. So it's not just about the technology, it's also the things behind the technology and how do we merge both the pedagogy, the andragogy, and the technology. Okay. So how do I move this thing?
Yeah, something looks like it's blocked.
Please move this window away from the shared application. I don't know how to move that, but I think I'll just go on for now because it's not blocking anything. Okay, so first a bit about active learning. Okay. And a revision about definition. It is important here because it's part of the UKM philosophy. And also, so in terms of the definition, what does it mean? It's an instructional video. It's an instructional method that engages students in learning process. Active learning requires students to do meaningful learning activities and think about what they are doing. So it's engaging, it's meaningful learning activities, and when they learn, they think about what they are doing. But why? Why do we need to do active learning? Because according to the learning pyramid, the average retention rates for active learning is much, much higher than the passive teaching methods. So, you know, you've worked hard preparing for the lecture. Of course, you want it to be effective as much as you can. So why not use active teaching methods? The other thing is, you know, when we are, you know, treating patients, we always talk about what does the systematic review say? In education, there's systematic reviews as well. And from a 2019 paper, from 69 studies, 58 out of 69 studies supported the use of active learning over passive learning. So that's about 84%. So if it's in our clinical practice, we would, of course, when the systematic review says that, we would change our clinical practice. So sounds like there is a lot of evidence there to show that we need to change our our teaching practices to use active learning. However, when we want to do active learning, we probably need to ask ourselves, how do we ask effective questions? And I've been wondering about this for a long time. And and I've been doing a bit of reading. I would like to share this with you. We can't, when we talk about teaching and learning, we can't run away from this, the Bloom's taxonomy. This is the revised version, 2001. As we go up the ladder, it's higher order thinking. As we go up the pyramid, is higher order thinking. The lower pyramid is lower order thinking. And if we combine this, so active learning is using the higher order thinking. But does that mean during our session, we ask only higher order thinking questions? Okay, so let's talk about that in the next slide. So it is important to produce good questions, because good questions, I remember, there are lectures that you attend and you go home feeling inspired because I think the speaker has asked good questions and they make you think. It's like those detective movies, the crime movies or crime shows, and you keep thinking, who's that? Who is that? Who's the culprit here? Who's the murderer here? And good questions can motivate learning. They stimulate critical thinking and they assess understanding and they shape positive environment. Okay, so excuse me for the busy slide. This just shows you again, this is the Bloom's taxonomy, again, from low to high. What does it mean? What are the verbs that you use in terms of learning outcomes, like apply, change, and for analysis is analyze, for evaluation is conclude. And these are some examples for higher order thinking, examples for medical questions that you can ask according to the level of Bloom's. So for example, if its application is predict probability that patient will present diabetes. You go up the ladder, discriminate between 3 similar skin rashes, and then you go up and up. Okay, a less busy slide. Okay, so this is the lower order thinking. Okay, and this is, and this is the higher order thinking. Okay, so what, waiting for the thing to disappear. Okay, so this is I got from Klein, okay, in his website, he wrote about asking effective questions. And he shared the different questions in between, not based on Bloom's, but it is based on the function of the questions. If you want to create a break or mark a transition, you ask the factual or summative questions. If you want to encourage interactivity, you would ask, Mark, what would you agree? Would you agree with Lucy on this point? Okay. This one is want to encourage participation, want to invite participation. I like this one. It says, instead of asking, Charles, give us your conclusion, please. I do that a lot. But he said that maybe a better question would be, Charles, would you be willing to offer your conclusion? So these are some of the questions based on the function that you want. Okay. So, but there is another thing Klein said in his article. he said there is this thing called the think time or the waiting time. So he said, there's this duration of time. If you ask the question, you should wait a certain amount of time before you answer. Sometimes there's silence and then you can't bear that silence and then you answer the question. Yeah, I do that as well a lot of times. But he said to wait a certain time so that you can get a good answer or the optimum answer. So how long do you think is the optimum think time? Anybody has a guess? I can't see my chat here because I'm used to use two different monitors, but because I'm concerned that my Wi-Fi is not working, so I am using my desktop today. So but the best, I guess, in a webinar, you have two monitors. So, but I don't have that two monitors with me, so I can't see the chat. So do you have any suggestions? What are how long should you wait between a question and another question? Anybody sees the chat there? I can look at the chat.
1 minute, perhaps.
1 minute, 2 minutes. Okay, actually, it's 5 seconds. Well, yeah, 1 minute is 2 minutes, definitely too long. He said 5 seconds. I have the reference, and it's based on a study. It's not his opinion. Okay, so that was something new to me. Okay, so it's not moving. Okay, so why don't we take a few moments to think about, the sessions that you had, the teaching and learning sessions that you had, and what were the good questions that you have asked? I guess, how do you know that was a good question? I think you can see their faces, especially that's during those times where it was face-to-face, you can see they were like, their facial expression. And you can see that they were intrigued and they were thinking. And then when you're discussing, you can see them nodding. Those are probably excellent questions that you have asked. Maybe anyone wants to share, like, what are some good questions that you have asked? Can I read from the chat, or somebody wants to say something? You can sort of shout.
Think a bit.
So I have to wait for 5 seconds. I forgot.
Because I'm teaching radiology, so mostly my students' faces are confused. So usually in the dark. So
oh yeah.
So that's why I appreciate online lectures.
They're usually in the dark. That's totally true. I like that. Okay. Can I share mine? Okay. One of it was, I asked my students, when we start lithium, how many days do we take after that? Do we take a lithium level? So that question was an ordinary question. So the answer was 5 days. And I asked, why is it 5 days? Why do you think it's 5 days? Yeah, and so they were thinking and that's when I said, why don't we go back to your preclinical years, and you had that pharmacology lecture, and you had some pharmacokinetics things, and yeah, and when at that time we discussed about half-life, and so it was related to half-life, and they really liked the fact that, this is how you apply half-life to your clinical situation. And I noticed that, yeah, okay, so that they liked that, the fact that there's some kind of meaning to the half-life. I mean, anybody else would like to share?
Yeah. Just asked, what makes you think health is complete physical?
Wow.
You know, what makes you think health is defined as complete physical as well as, you know, social and psychological
Prof.
well-being?
Tong, I think that question is so deep, it makes my hair stand. It's so deep, like, wow. In psychiatry, we call this psychodynamic. It's very deep questions. And, you know, you go home and in the car, you keep thinking about it. Yeah. Okay, then I'll go to the, I mean, that's something for you. I think it's something for you to reflect upon so that you keep, you know, you keep asking those questions. So I'm in the chat, I think, okay, in the chat, I have include this link where, you know, you can write, it's the table just now that I've shared with you, but then you can fill in your questions. And I suggest what you do is, if it's like pharmacology, like for me, it's psychopharmacology session, then I'll put in the psychopharmacology questions that I want to ask. If it's managing aggression session, you put in a managing aggression questions that you want to ask. So you can use the link to download the worksheet.
Can I just interrupt?
Yes.
Yeah, can you allow the editing or because we need to request permission to type in
Right.
Google Sheet.
Can you? I think I put in download, and then you can, after you download, then you can edit.
Yeah, but I need to have permission.
Oh, it needs permission, is it? Okay. So I'll do that later on. So that, I mean, this is for worksheet for your own use. Yeah.
Right.
Okay. So I didn't realize that it needs permission. Okay. Okay. So this one. So in the end, what I've after reading all that. Okay. Sorry, but there's this. Okay. Okay, in the end, after reading up all that, this is what that I concluded for myself. When you have a lecture, there's probably, you have some kind of outline. There's the introduction, topic 1, topic 2, topic 3, and then there's the closing. So, and probably this is the anatomy of asking effective questions, okay? So maybe with the introduction, after the introduction, you might want to ask about something that the audience is familiar with. Probably you might want to ask, for me, maybe, you know, do you know anyone who has had depression, a friend, maybe a relative, or, you know, probably very simple question that, you know, just to, is a warming up questions and here. And it's even better that it is related to something they have learned in the past. So probably that's that kind of question in the introduction. And then you go into topic 1, and then there's this transition section. I think that's from the client. Client said from one topic to the other, maybe you want to have some kind of transition. So that's probably a factual or summative question. And then there's topic 2. So you might want to ask, because, and along the way, you go from the remembering questions up to the creating questions, okay? So, however, because we're talking today, it's about online lecture, it's a lecture. So there might be questions here that might not be suitable for lectures. It may be a TBL question, or it may be an assignment question. So we might want to choose what questions that we might want to put it here. Like Prof. Tong's question that, you know, if I get that question, I would be thinking about it for days. Yeah, because it is so interesting. So then, And because it's closing, there's probably a closing question. So like if you had to pick out 3 themes that surface most often in our discussion today, what would they be? So this is a closing question. So this is the anatomy of asking effective question. Oops. Okay, so moving on to the third aspect, which is how do we do all this online? So this is where I think Dr. Aida will be demonstrating exciting ways of doing it online. I've looked at her questions. I'm excited to, I know I can't answer them, unfortunately, but it looks interesting. Okay, so what do we call this thing? It is called student response system or audience response system or classroom response system. The olden days, it's called clickers, okay? When there's, it's called clickers. One of the things that me and Aida did was we looked at some of the ARS. Okay, these are some of the ARS, and we put them in a table. And mind you, this is free, the free version. So if you want to purchase, these are the price per month, but billed annually. And there are education price. These are education prices. But when we put this information, it means that they are free versions, the free versions. So you can look at, if you look at this, it's about the number of the audience, how many presentations. And I think here, because we're talking about questions, the type of questions that you can ask for the free version. Okay, so I pass on to Dr. Aida, who will demonstrate us by using WooClap.
Right, thank you, Dr. Tuti. Right, I will share my screen. Okay, is it clear? All right. So my name is Dr. Aida-Widure Mustapha. I'm a lecturer or a clinical specialist at the radiology department here at HUKM. And I have to admit that MCHO has really propelled me into the world of online, which I have never thought about before. I am now having flashbacks of my own lecture when I was in a medical student. And I remember that it was physical. It was so many, especially when I was in first, there were so many students. Most of them were mat salleh, and you feel really, really daunting, isolated, lonely, and you feel like, do I fit in? You know, all those negative thoughts are there. And then when the lecture starts, it's basically slides after slides of words after words of new concepts. Obviously, medicine has a lot of science concepts which sometimes are new, sometimes are a little bit of flashback of your biology days, but still everything was lonely. You are on your own. You haven't even introduced yourself to your next door neighbor or your next door seat. So I remember at that time thinking, was there another way was there another way for them to teach me besides going from one lecture to the next? And then sometimes the lecture from one lecture to the next lecture is climbing up another hill or going up to another building, and then you're tired, and then you think, it's like everybody is racing to get to the front row, or maybe you're racing to get to the back row, it depends. But I remember using those lecture times as times to, berangan or just to, observe all the other students on their behavior, their clothing, everything that a teenager can think of. Those are the times when you are on your own, in your own cloud. So if I think back now, if I think that I had the technology that we have now back then, I would be, I don't know, I think I would be a better student. I think I would be, I think it would probably changed my personality to be more engaging. I remember being quite timid during my medical student days, and I remember there was this one time the lecturer actually asked a question and he picked me, and I was like, seriously, you are picking me? And I thought, okay, I think I know the answer for this question, and I felt quite confident, so I gave the answer, and then it turned out it was wrong. So I felt really, you know, I felt really embarrassed. I felt really embarrassed because it was the whole class. It was the whole lecture hall full of students, at about what 130, 150 students, and they all looked at me. You know, this Asian girl who got it wrong. So I felt really embarrassed, and I couldn't really enjoy much of my lectures then. So it took a lot of, you know, how to say, tenangkan diri sendiri, you know, pacifying myself. No, it's okay, just go to your lectures, and hopefully you will learn something. So that is my sharing of yapping away. So the title of my lecture, of my presentation, is creating an interactive lecture online. So what I'm trying to do is for you to pretend that you are my students and that I am giving you a lecture, and I hope that it will be a bit more interactive than a normal lecture would be. Okay, and then we are doing it online. So I would like all of you to participate with me by scanning or putting in your phone the website address. Okay, so then we can, I'll give you a few minutes to do that.
So those on our Facebook, they also can participate.
Yes. Hi, Facebooks, come participate. 9, okay. I was hoping more than 10. Okay, 10. Hi, okay. How do I go out from my message? Sorry, I'm still new to this messaging. Presentation. Sorry, what do you see at the moment? Do you see the word hi or do you see the barcode?
Hi.
Oh, itulah. How do I go back? Kejap eh. Presentation code. Okay. All right. So I have 10. Anyone else? Okay, never mind. Should I carry on? Okay, wait a bit more. It's 11. It's nothing. It's just questions. Obviously there's right and wrong answers, but I don't expect you to get the right answers. Okay. Okay. Because these are all made up questions, so don't worry. Even I am not sure whether they are correct or not.
Oh, that's reassuring.
Yes. I've kind of dipped my finger into other people's department, other people's specialty, so I think, never mind, whatever. Okay, can we go on? I think 12 is all right, isn't it? So a bit of introduction. Now, I know we are all giving lectures to none other than digital natives. You cannot run away from it. It's impossible that your students are not digital natives nowadays. So they are immersed in technology. And so I think that if we want to get their attention, we want to engage them, we have to be digital as well. And we are then thus labeled digital immigrants, where we come from non-digital world, which we are, we survived. And now we are adapting and utilizing all these digital technologies, and therefore we are digital immigrants. And I must say so that we are quite good. We're not so bad, okay? And as I've told you about my story, I've just described my experience as a medical student. So that would be the traditional approach of a lecture. Usually when I say lecture, I mean you have a lecturer who is trying to impart or teach a knowledge or a concept or anything. Usually, but not always, but usually it's the first time that the student has encountered the knowledge, and that there is no elements of grading. That means within the lecture, there's no incorporation of grading or questions that will carry any marks, okay? And it is done synchronously. That means the platform or the time that the lecturer and the students are at the same time, okay? So that would be my definition of a lecture. And usually in the past, it has been one way, or I mean, although it's not effective, but it could, I mean, it was effective as long as there is impartition of knowledge or content from lecturer to students. So that would be my definition of lecture for this program, okay? So there are obviously numerous methods for implementing an active learning approach, as Dr. Tuti has mentioned before. But I think because we are talking about a lecture, it involves a platform of one lecturer to many students, usually about 80 to 150. So there is not much way of getting engagement from the student except for when you're asking questions. Because as you know, when you are getting, if you're asking for a volunteer to, in a lecture setting, it will be quite difficult. And also, like I've shown you with my experience, it can be a slightly negative experience for the student. So and then for that, then it can slightly hinder, it can give a slightly negative outcome for the student, and therefore the student will lose interest in engagement and therefore lose interest in learning. So in a lecture format where it is usually the first time that the student is experiencing the knowledge or the content, yes, it is ideal for the lecturer to ask questions in order to engagement, but for the way the student respond has to be in a more neutral and safe environment. And hence, I think for this digital world, the use of systems, student response system or audience response system or classroom response system is very much welcome and appreciated, because it takes away this singling out students, it takes away the anxiety for students, and but it creates a much more positive environment for a lecture. Okay. So now that we've decided that we want to use questions as a mean to get interaction from students. So how do we do it? Usually, if you have a small audience, let's say 20, then yes, you can even online, you can actually single out those students. Like for example, you ask the names. So there are many apps now on the internet where you can put all the names of the students, and they will randomly pick a student for you to ask. So that means the student doesn't feel that the student is being picked on by the lecturer or always being picked on by the lecturer. They know that it's been randomly picked by an app, so they feel, they don't feel anything. They feel neutral. They don't feel singled out. For example, you can also get interaction from discussion in pairs or groups to find the answer. But I think this is more suitable if the student has had experience to the knowledge or the content prior, and now has just wanted to enhance further or discuss further on the subject matter. But I think that discussions in pairs or groups, yes, it can still be done in a lecture, but probably for a medium-sized audience, and much better in a face-to-face setting rather than a large lecture and also online. So if we want to have a good lecture, although you have a big classroom, you can still achieve that by getting all the students to answer your questions. And it is possible nowadays with the technology, as I've mentioned, using a student response system. So in this way, you get everybody to get involved, you get feedback for everybody also, and your lecture will be more effective. So the solution that we're advocating for an interactive lecture online is to use a student response system, or the other name, audience response system, classroom response system during a lecture. Okay, so let's now do some brainstorming. So now that you've all, what do you call it? Hung up by me on the concept of interactive lecture, can you tell me a benefit? What benefit do you think there is for the lecturers, and what benefit are there for the students for an interactive lecture?
Right, it's just going to type.
Oh, what happened to my participant? It's still 0.
9.
Oh, okay, now I understand the number here. Okay. Yes, higher retention for lecturers. Okay.
Silap.
Tak apa, silap you boleh patah balik. Not sleepy. Okay, I hope not. So if you're a lecturer, student understand more. Okay. Any more?
I have
No level of knowledge. Yes, this is very good. No level of knowledge of students. Lecturer put enjoy. I have full control. Exactly. Anything for the students? It's all for me, me, me. Me.
Oh, boleh benefit for students. Okay.
Yes, you have to put in categories.
Okay.
If you are confused, there's a button at the top. You can change it from confused to got it. Students enjoy, yes. Higher retention, yes. Anything else? Prepared, yes. Prepared. Okay. Increased understanding. Anything else? Has everybody should get about 10 pairs if I have 10 people. Students will be more alert. Increased understanding. Prepared, yes. Come to lecture prepared, yes. Convenience, time, place, yes. I agree with this. What is this button? Let me just sort my category. What is this? Oh, I can change it by grade. Sorted by grade. Students being appreciated when answer questions. Okay, I think that should be for students, but yes, I agree. Okay, so I see there are a bit more benefit for lecturers, but I think some of it should be under benefit for students. Thank you very much for your input. So as you can see, there are so many benefits for lecturers and also for students, but mainly we are here for the students. So yes, correct, less anxiety for students. We were all students once, so we know the anxiety, especially when you are learning a new lecture content and then you get picked on, or you suddenly asked to discuss about it. How do you want to discuss if you haven't really understood the content? Especially student will get chance to participate, yes. So nobody will be feel left out, except of course if you don't have a handphone. But nowadays, no, all the digital natives would have a handphone. And yes, the important thing is not sleepy, especially for students. I find that's one of the main problems, because as teenagers or young adults, they need more sleep than us. So yeah, they will just churi sleep anytime. Less fear of asking questions compared to face. That is so true. Yes, I agree. So as you can see, there are lots of benefits for lectures, but the main aim of an interactive lecture online is for the students, and all of it, whatever benefits that you've put here, they're all correct, but ultimately we want to be engaging with the students, so therefore they are more engaged in the content of the lecture itself, and therefore it will stimulate learning, and therefore they will go on back to their own time and read up on it after having had instant feedback during the lecture as to the areas that they know they are a bit weak on or they haven't read. So all in all, overall, it has a very positive feedback, for students learning. Okay, all right, okay, so we'll move on. So for lecturers, I mean, these are my top three. Not that I'm saying that yours is wrong, but it's my top three. Self-accomplishment. I mean, hello, yes, we want to see the students be able to understand our content, be able to say, oh, Dr. Aida, your lecture was, I understood, or I know now where I went wrong. So that gives great gratification, okay? And also students' high achievement obviously reflects well on the department and faculty. But ultimately, we know from the questions, from the feedback or answers that the student give, we know which area that they have misunderstood or have not yet understood. So we can then advise further by giving extra classes or giving extra notes, or even just highlighting to students, look, you have to read up on this, blah, blah, blah. So overall, it's a very good, it's also beneficial for lecturers, okay? So now I want you to give me all the opposite words that you can think of for active, and any opposite words that you can think of for interactive. So these are all the words that we don't want the students to feel. So start writing. Give me some words that are the opposite of active or the opposite of interactive? Come on, I want to see. Yes, passive, sleepy. We don't want those kind of students in our lecture anymore. Quiet, yes. Dormant, yes. Sleepy, yes. Passive, quiet, yes. We don't want staring. Oh my God, that is me. Yes, when I was younger, staring at the clothes, staring at the, I don't know, just staring. Okay, tak bersemangat, yes. Correct. Anything else? Come on, come on. I know you can do, give me more words that are opposite of active, opposite of interactive. Maybe isolate, lonely, quiet, dormant, doodling, yes, doodling. It's like, doodling is like interacting with yourself, kan? Actively, self-active. Staring, sleepy, okay. Anything else? Rasa tak best. Rasa tak best, dormant, tired. Okay. So would you like to enter a lecture and then feeling all of this at the end of it? No, right? We don't want to do that. And I'm sure that some of these adjectives, isn't it? Adjectives are some of the adjectives that you've experienced yourself when you were a student. Okay. So the aim of a lecture online is to try and beat the opposites of all of this. Okay. So thank you very much. I have a message here. I don't know how to. Oh, hi. Okay. I'm not sure how to go back. Sorry, I'm a bit new to this technology. I'm not sure how to move on. Uh-oh. What do I press? I'm going to see my message, but then I don't know how to go back to my presentation. Okay. All right. So good. These are all the negative or opposite things that we want our students to feel. So at the end of the day, we want engagement. We don't want any of the words that you've just given me just now. We want engagement. We want the students to have fun. We have more positive response to instruction, and therefore they have feeling more attentive in the taught sessions. And it also creates eagerness or anticipation during the lecture. If you have this label already, oh, radiology department memang best, every time lecture memang semua interactive, so that kind of labeling that you want to achieve. Okay, so and it also, when they get it wrong, they feel okay, but it actually helps them to refocus on the things that they have not read yet or things that they feel a bit weak in. And also seeing all the responses from the other students, it actually helps them to reflect upon where they are in terms of all their peers. Okay, and also, because it is a lecture, an interactive one, and there is no grading. I mean, they know that if they got it wrong, it's not going to be graded or be part of a grade somewhere. So they feel like the feedback is very, very useful, and then they can get it instantaneously and at that moment, rather than waiting for an exam to do so. So all in all, it is the engagement that we want to get from these lectures. Okay. So what are the elements in an interactive lecture? So I would like to advocate that you always have to give preparatory material to your students before the lecture, because there is no way that they will be able to be interactive with you of the content if they have not read it before. It can either be notes, it can be you are a resource or a book or page of a textbook, whatever that they have to read up first before coming to the lecture. Because I think in order to be interactive, you have to have a bit of knowledge. And if the students feel like they've never experienced the content or the knowledge before, then it's very difficult for them to be interactive. And the other thing is the lecturer's voice. Now I would like to just talk about on the lecturer. Like for me, at the moment, I am using my engaging voice, if you notice. Excited, keen, not monotonous. Imagine that you are talking to somebody who's monotonous. Sorry, imagine that you're listening to somebody who's monotonous and not engaging. You wouldn't want to feel that you want to interact with someone like that. So it's on in all, you want to get that, because interaction is two-way. So you want to have that engaging voice, and then they will give you a positive feedback. And the other thing that the literature has also mentioned is about introduction. Like, for example, you can give a photo of yourself if you've not met the students, or you can possibly put a picture of I don't know, your hobby or something, just to show that you are human too. Because we are all, remember, we are in the online setting. We are not even in the same space. Okay, we might be in different states, but we are here now synchronously online. So if you want to encourage interaction with that person, you have to give a little bit of yourself, either just a short story, photograph, or just a small introduction. And also it will actually gives a kind of a immediate we call it immediate engagement, so that they know that it's somebody that they can interact with, they trust, and they feel comfortable with. Now the second element, the next element is the feedback for the students. So that means that once you get an answer from them, they would like to get back a feedback. So in terms of graphs or word cloud that I've just shown you just now, or it could be, if you want to make it a step further, your interactive lecture can actually be a part of a whole game. It can be totally just a game period, where examples, you have Jeopardy, Monsters, Dinosaur, all sorts of games that you can search online, that you can conduct as an online lecture. Also, studies have shown that the attention for students are not long. So after about 15 to 20 minutes of content or explanation, maybe you want to put a few questions to gauge the understanding, and also to get their attention back again. The questions that you pose in a lecture setting are usually not to single them out, whether who's remembered who or who did not understand what, but it's just a matter of trying to emphasize on certain ideas that you think are important for that topic, and to recap, or maybe to amend any specific facts, or maybe things that you think that the student might misunderstood. Okay. And the design of the question, obviously, it can be either closed or open-ended. You can use images or the label, and always don't forget to provide a I don't know option. It's not for you to single out the less pandai students, no, but it's because then it will prevent students to feel anxious for not knowing the answer, and also it prevents them from guessing the answer. So it actually again creates a safe environment for the students to learn. And then the student response system, like the one I'm using now, WooClap, you can either sim it into the lecture, or you want to use it at the end. So these are all the elements that I think are important in an interactive lecture. So for Fakulti Perubatan, I think it's a lot of it is knowledge based, whether they can is either factual knowledge, for example, the epidemiology of disease, reasons for emergency. These are all factual that they have to know, they have to remember, and these are just some of the examples, just a little bit example of the vast knowledge that we have in the faculty. So it's obviously slightly different from kind of like, for example, accounting faculty or whatever. It's difficult to sometimes, I find it difficult sometimes to ask these kind of questions, medical related factual knowledge in an interactive lecture. But I would like to show you some examples that I think would work, and it will also be beneficial for our students. Okay, so let's try. Okay, so this is an example of a factual knowledge again. So I want you to try and vote and tell me the answer. So this is nothing, there's no, what do you call it? It's just, can you remember it or not? There's no processing involved. Yeah. 10 cm, wow, 10 cm, okay. It's okay if you get it wrong. And it's interesting to see my students. Yes, come on. I need 17 numbers popping up here. 10 cm, good. Okay. Any more answers? Let's see. Most people answers. So two of you answered 10. Okay, so the most common is 10 cm. Right, okay. So I know now there is a slight lacking in the what do you call it? Kesedaran of the diameter of the abnormal. So these are the things that then you can say, okay, so the abnormal shouldn't be blah blah blah. So you can give instant feedback by in this way. So this is just only about a few, maybe how many did I get? About 6. But imagine if it's a classroom full of answers, and then we will be able to show, oh, most of you answered far off. You know, the answers should be about 3. So all of you are far off from the answer. It's okay. We will do a revision course and the anatomy tomorrow. All right, let's move on. Right, now try to answer. This is again another factual medical answer. Okay, try to fill in the text with the correct answer. You can click on the image to see it, but I don't think the image is just an example. But the main idea is, what would you put in the in the number 1 and number 2? What words would you, what word is correct for number 1 and number 2? It's okay if you get it wrong. This is the first time that you've come across this knowledge. Right, nobody's answering yet.
Quite tough.
Yeah, never mind. Just write any words. It's okay. It's okay.
Here.
Just write any words.
Bright.
But these are the kind of questions. Imagine, so can you feel it that you are the students and you feel, oh my God, this is tough. But at the same time, don't you want to know the answer, and don't you want to know how the other friends are doing? Okay, good. So we've got black, hyperdense, whiter. Yes, so, okay, I've gotten 4 answers. Okay, so how do I do this? Okay, I think we've done answering. Is there any more? I don't know. Okay, so then this is the opportunity for you then to give feedback to your students. Say, yes, blah, 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 well done to blah, blah, blah. Look, this, and then you can use this time then to explain why is it more hyperdense and why is it more isodense to brain matter. So this is just another example how you can engage your students to be aware that this is an important concept for them to grasp. Okay, let's move on to the next question. This one is nicer. Where's my answer? Where is my question? Okay, in here you just point which of these are adverse effects of systemic steroids. So you just point to, on the image, all the adverse effects that you think that can happen in a systemic steroids. You can do multiple points on the boxes. So I want, again, this is more of a factual kind of knowledge, but we make it a bit more different formats so that the students are engaged in it and not get bored just by multiple choice questions. Oh, good, yes. Yes, I agree, hypertension. The more students answer for one particular box, and the more landmark it will appear. Okay, but I only have 3 responses. Can I have a bit more? You can have multiple, this is just apply to any boxes that you think applies. It doesn't matter how many. So if you have a concept or something similar to this kind of questions, clinical questions, then yes, you can make it like this. So there are many ways you can construct your questions, and it will always be interactive. Okay. Yes, adrenal suppression, 2 people, immunosuppression. Okay, that's it. Okay. How about the rest? Do you think it's not are not effects of systemic steroids?
I think we are allowed to pick only one question, one answer.
No, I put it multiple.
Multiple.
Yeah.
Can't seem to do that.
Can't seem to do that. Okay lah, never mind. It's okay. I don't know why I've done it. So the correct answers is obviously all of these boxes except for this one. So these are the kind of feedbacks. I mean, these are kind of questions. I think it's very fun, and you can instantly just click mana yang apply. So it's very quick, easy, and so much fun. Okay, let's do the second one. So how about visual speech spatial knowledge? It would include images of anatomy, radiology images. I also included flowcharts because I think flowcharts are kind of quite visual as well. Maybe you can put images of the patient's skin and ask them questions on those, endoscopy images or diagrams of cells or atoms, etc. So let's look at some examples. Okay, this is a chest radiograph. Where do you think the abnormality is? Just point on the chest radiograph. Yay! Okay, two got, okay, I've got 3 responses. Very good. Any more? Gotten 5 answers. Good. Okay, so this is very quick and easy. You see students can zoom in quickly. They don't feel offended. They don't feel, shy to answer. So then I will go on to say where is the correct answer, and then explain to them that yes, this is correct, very well done. They get instant answer and instant comparison with their peers. So let's try this one. This is I don't know what you call it. This is a multiple choice, I think. Yeah. So for the abnormality just now, here that you've seen, how would you describe it? Would you use, yeah, okay. So most of you, okay, good. Constellation, ground glass opacity. Wow, good. So nobody is, I don't know. Good, okay, a mass, okay. All right. So then I see that most of you have answered consolidation. Okay, all right. Wow, okay. Similar number have answered consolidation and ground glass opacity. So this again is an opportunity to rectify any misunderstanding if there is any. So if I show the correct answer, let's say we stop the answering session here. Okay, mass. Any more answers? Okay, so let's try. So let's say I say ground glass opacity, I think, okay. Then I would then say why is it so and blah, blah, blah. So this is very good. Okay, how about this one? What is the location descriptor of the abnormality? The same chest radiograph. So again, I'm testing the students whether they understand the spatial concept in a chest radiograph. Sometimes I think this lecture online would be nice if we have some background music, just a mild one, so it keeps everything so, like, because I feel like sometimes I need to talk all the time. Okay, so most of you have answered this. So this is again opportunity for me to reveal the correct answer and then do discussions on it. So let's move on to another example. Now this one I think like is terbalik. I'm not sure. I'm not an expert in endoscopy, but where do you think the epiglottis is? So you can point it on the image. So this is actually good. If you have an abnormality question, for example, on an image, you can just say, where is the abnormality? Or even anatomy labeling, where is this, where is that, And for this particular WooClap, you can put more than one place where it is correct. So only one answered there. Okay, any other answers? Okay. Okay, good. Okay, my students are bright students. You answered it. It's very good. Okay, so again, another. Oh, I've got another answer. Yes, very good. Okay, so I think you get the idea that it's very easy to do. So then the lecturer will say, okay, let's look at the correct answer. And then you go, yes. And then you explain, and you go on to the next. And this opportunity again to give feedback to the student, why is this not the epiglottis and so forth. Okay, this is another example. If you were to match examination, for example, to a finding, this one I've just randomly chosen from the internet. So if you want to have a go, this is a matching question. Remember, this one this lecture that I'm doing is giving you more of examples of questions, but I think in a real interactive lecture online, you will be able to give feedback and then you tell the student why is it so, and it gives, that is the interactive part. But for now, we're just kind of zooming through the questions. Okay, any answers? Nobody's answering. It's difficult, yeah? Mawada can answer this. I cannot answer this. Okay, let's have a look. Without parentheses. Okay, all right. Bilateral paralysis. Okay. So the most frequent answer is, let me see the correct answer. So the most frequent answer is, oh, okay, all the same. All right, very good. You're all very good students. Let's move on. So this is an example of a process, how to recognize the different processes and put them in the correct order. So you can use this for more of physiology type of content, maybe in endocrine, for example, or I don't know, there's so many applications that you can put the correct order for processes. Okay, so I think we can just zoom through this one because I'm sure you get it right anyway. So if I show the correct answer, then yes. Okay, let's move on. Okay, now this one I need you to answer. So after listening to my talk, the part of the talk, which of these do you think is the most important factor for a good interactive lecture online?
Oh, I see.
Yeah, it takes a bit of you give weightage to them.
You give weightage? Oh, so you put
many plus sign.
Oh, I see. Okay.
So I have 100 points to distribute.
Yeah, to distribute between the 5. Okay, let's have a look at the statistics. Oh, this is the results. Okay. Sorted choices. So most of you said that the online student response system is easy to use. Okay, true, because the majority of the setting is students. So if it's not easy to use, then you're going to lose your students, isn't it? If you have 150 students, if you don't have an easy student online response, then you're going to lose them. And yes, students have to be given preparatory material. I agree, because it's I think it's not nice for the students if they don't have any preparatory material and then coming into the lecture and expect it to be interactive. And also online instant feedback given to students. Yes. Also now it's gone up to the top of the list. Yes. I think this is important because that's the whole idea of the interactive is you give and then you have to give back to the students the feedback. And lastly, yeah, the lecturer's voice is clear, energetic, and non-threatening. That should be the last. Yeah, I agree, because if even if the lecturer's voice is monotonous, but if he's somebody who is very respected, contohnya, they will give response juga. Okay, so let's have a look at results. So now, yes, the winner would be the online student response system is easy to use. And you can use any of the system that that Tuti has showed in the table in her lecture. So let's move on. Thank you for your feedback. So this is my last slide. So in conclusion, that the enjoyment and the interactivity, yes, obviously it does not determine learning, but they are necessary because it is the outcome of it. It is the positive outcome of it that will stimulate teaching. And the key feature in a student response system is the ability to gain instant feedback once voting has taken place. And prompt feedback allows students to confirm whether they have understood a topic or not, and helps them to become aware of their learning needs. And again, student response system is the opportunity for increased self-reflection in both students and teachers. And overall, all of this will lead to better outcomes, as positive or negative feedbacks helps your self-reflection and on the students' learning. Okay, thank you very much. This is the end of my lecture. I will stop share now. Oh, sorry, I forgot. There's one more. I wanted to see who was the winner.
Oh, is it? There's also a game built.
Yeah, you can. You can. I don't. How do I go? How do I show? Top 3. Wait, okay, maybe I can. How do I do this? I want to show this one. It's not coming out, yeah?
Yeah.
I also don't know lah. Because I'm still new to this thing. Oh, two are confused, you see? So I know that in my, let's say I'm yapping away about a content, and then I know, oh, okay, 3 are confused. And then you can see that the confused number will go down as you explain further. Oh, I'm so not, I don't know how to show you the winner. Oh, presentation, exit.
Share screen, is it?
Oh, you're not sharing. I'm not sharing. No, but still, I cannot see on my. I cannot see on my knee. I cannot see on my page. See, I tekan here, and it's not coming out. There, dia patut ada keluar winner. Dia kan Tuti. Yesterday we were trying it out. Mana? Kau tak tahu. No idea. Pelik juga benda ni. Oh, kita tekan sini. And then, okay lah, tak apalah. I'll figure it out later. Alright, thank you very much.
Thank you, Dr. Aida and Dr. Tuti. I think it's been an hour plus.
Oh, okay.
And all of us still awake.
Oh, you can. Oh, I thought you want to say all of us are not. Or have all gone.
It's fun.
I have just a bit of a conclusion, sikit.
Sure. Go ahead, please.
Okay. Okay, so just a bit of going back to this, because Pingo here, if you notice, it's the only one that's free. Okay, so therefore, I think it's important that you try to go to Pingo, and because it's free, you can't. Aida's Wood Club is paid version. Okay, so this one is what Pingo looks like. So it does have a bit of a word cloud. And I guess the important thing, it depends on the question that you want to ask. So have a try on Pingo because it's free. But what I think the important thing that we would like to conclude here today is, one is, as we know, we need to apply active learning because why it works, okay? And we need to ask effective questions because by using the Bloom's taxonomy and probably using various questions according to the where you are in your lecture. And then after that is asking, how do you do it online? I think I really enjoyed Dr. Aida's questions. I really like the colors. And I really like the fact that the variety of ways that you can ask the question. I guess the question, the thing here is, if you want to use a free version, then what do you do? So that goes back to that diagram. So one is, we would advise first is you ask yourself, how many students are there? So if it's 25, quiz is good. And why I put quiz is because I wanted to sort of not discuss it, but then when I looked at the review, in 2021, quiz is the top, okay? However, the free version is for 25 students. If your students is 50 or less, Socrative would be best, okay? So looking at the number of students would be number one. Number two is looking at the type of questions that you want to ask, because as we discussed before, asking effective questions, we need a variety type of function in the way that we ask. So what is important in WooClap is if you have if you are in a field where anatomy is very important and diagram is very important, I think WooClap is excellent. I'm not sure whether the other, we did not really check whether the other apps, they cater for visual spatial, but I guess WooClap is excellent. I really enjoyed myself just now. So if you notice with Kahoot, there's only 2 questions, even the 2 types of questions. That means you cannot use that Bloom's taxonomy in terms of going to, asking variety of questions. So I guess here, it depends on the audience. It depends on the type of questions that you want to ask. Okay, so I think that's all. I hope you sort of, I think this is part of the thing that we're struggling with if we do not want to pay. If we want to pay, no problem. I think there's a lot of choices out there. So that's all for our talk. And practicing the types of questions that we should ask, I would like to, if you could go to this Google page and you use your QR code. Okay, boleh ke? Semua boleh akses ke? And if you could answer, name one important thing you learned from this session today. And if you could click on that square thing in the left, that's a sticky note. And if you could put a sticky note and share with us that one important thing that you learned from this session today, that would be great. Yeah, thank you.
Right. You may just want to make the QR code there remain so that they can.
Okay.
Yeah.
Okay.
So that the Facebook, there is a lag time in space.
Okay.
Yeah. Right. Thank you very much. I think thanks, Dr. Tuti. Well summarized at the end. In fact, I was about to ask you to flashback this table, and you just did it. Okay. So I'm open for question, and I think it has been a very enjoyable session. And thank you. I really enjoyed answering those questions. Back to my medical student days. Right. Any question? The Facebooks, those are viewing Facebook, you can ask question. I'm on Facebook as well, so I can read a question. Right. To us, many of us, I just ask question intuitively in the class without thinking through anatomy so much. That is a wonderful sharing of level of difficulty. Yeah. Dr. Tuti, just feedback. I think we still need. I'm not sure. I'm just getting.
Oh yeah, mine to request.
Request of permission.
Oh, masih request permission lagi ya? Okay, okay. So really sorry about that. Okay, I will put another link again, maybe later. Okay, I would have to change the setting again. Okay, sorry about that.
So I suppose debriefing is part of the question in interactive at the end. of a lecture, Dr. Tuti? If we do debriefing.
In terms of the, like, what you did well and what.
Yeah.
Yes. Yeah. It depends. For lectures, probably. I don't really do it for lectures, and I guess it depends on the content as well, because but we do discuss things like, why do you answer it that way, and why did you answer it that way. That's also another thing that we can do. But in the context of an online lecture, sometimes that's a bit limited, but in a team-based learning, that would be more feasible, I think.
Right.
Yeah, agree. I don't know how to get back to Tuti's barcode just now. I think we can
yeah.
wrap it up, kan?
It's about time, because only it's 1.5 hours we are spending here. And I thank you all again for participating for that interactive session. I think it demonstrated very well the use of Google. I have not used it before. Now it's a variety of questions. I certainly want to try that out. But many of us have many experience with others. Thank you for this table, and that's very valuable, Dr. Tuti. And with that, thank you all for participating, especially Dr. Aida and Dr. Tuti for sharing a valuable experience. We are looking forward for another session next month. So next month, we're going to have How I Do It session. So please share the news. Anybody who would like to share, not necessary, you might have your own creative ideas, and we would just like to hear from you and share it out for our faculty members. Right. Thank you very much, and have a nice evening. Also, it's about 5 to 4, so I think we will just close it. Thank you very much.
Thank you and welcome.
Thank you.
Yeah, we have actually 47